what are some common barriers to talking about or seeking mental health in your communities?
There's many barriers, as we know, so I'll talk about one of the barriers. I think one of the barriers is lack of financial resources. A lot of our people in our community are uninsured or they're in survival mode, so they're struggling to make ends meet, so they're more focused on meeting their basic needs. So mental health just kind of takes the back burner. So one of the barriers for that I want to speak about is lack of financial resources.
I'll just add on to that, that layered with that inaccessibility is the distrust of systems from systemic racism, where care has historically been inaccessible, ineffective, marginalized, and harmful language, harmful practices, and not culturally relevant. To add to that is that we are understaffed with culturally competent providers. In my personal life, looking for a provider for friends or children, it is very, very difficult to find an accessible doctor that has even availability within a year, that understands what systemic racism, how it plays a factor in our mental health and our well-being. And then when you do actually get an appointment, it's very, very hard to find follow-up care. So just adding to that.
I would add language access is a huge issue. So just like culture being such an important lens that we see mental health through, language is just as important, and they're very interconnected. In my culture, in my language, for example, we don't have a word for depression. We have other words that could work, but those also carry very different contexts and meanings to them. And so because of that, when one of our community members is going to a mental health professional, and if the translation's off, or if there isn't somewhere there that can speak that language in any capacity, they could be hearing a completely different set of, help or advice or treatment than what they might need. And mental health is a moving target. It's not like a fixed location. So having a professional that isn't able to speak your language, or there's no one there to help translate it, just makes that journey way more difficult, and oftentimes can lead to the wrong places or wrong conclusions in that person's head.
I'd like to mention the generational gap in a lot of Asian families, even like from the first generation, second generation, and the third generation. There are a lot of gaps because of the language barrier. The first generation probably speaking in fully Korean, and the 1.5 or second generation speaking in Korean and English, and third generation only speaking English. So because of the language barrier and cultural barrier, they cannot properly communicate and understand each other, even in the family. So often we need a systematic change inside the family system, but it's very hard to be addressed because of that type of gaps.